Hi, I'm Dr. Fred Wilder. I am a board-certified plastic surgeon. So one of the most important things, especially with breast surgery, but really with any operation we do, is properly setting your level of expectations of what a given operation will do. What you have to realize about breast implants is that a breast implant basically makes a breast bigger. Now, some people tell me that they want more fullness, but they don't want to be bigger. That can't happen. You can't put something in that makes it bigger in order to get fullness without then being a larger cup size. And what I tell most women, because you have to put in enough implant to reasonably fit a breast in terms of the diameter of the breast compared with the diameter of the implant, that the average woman is going to become at least a cup size bigger with the most modest of implants that we put in. So an A cup would become a B cup, a C cup, and so forth. What you have to understand about an implant does not change the locations of things such as the nipple and the fold under the breast. An implant does not go inside a breast. An implant basically goes entirely behind the breast and sits on the chest wall as a spacer and pushes your breast forward. So it's crucially important, in order for it to look natural, to try to get the implant centered behind the nipple as much as possible. And that's both true with a left-right dimension. If, for example, somebody has very wide-set breasts where the nipples are far apart and you try to get too greedy creating cleavage, then oftentimes you might have fullness in the cleavage area, but it may make the nipples look like they're on the outside of the breast. So implants really need to be centered properly behind the breast. The left to right part is the easy part. The harder part is top to bottom, because an implant cannot go lower than the fold under your breast where your bra wire sits. That's the lower limit of the breast. So when a woman's breast hangs lower than that, that's when a breast is considered droopy, and oftentimes a lift needs to be done. It should be obvious that nipples don't either point straight ahead or at the floor. There's a whole spectrum where the nipple can be, and as long as the nipple is even slightly above the fold under the breast, and you can simply put something under your breast and look in the mirror to determine whether the nipple is above, below, or right on that line. And then if it's borderline droopy, then oftentimes you can get by with an implant. Better to use a smaller implant so that it doesn't show as much at the top. And we've learned to do it in a way where we do what's called a dual plane or a biplanar technique, where we release the muscle, since most of the time we put these implants under the muscle, in order to let that implant sit as low on the chest wall as possible. But at the end of the day, the implant is simply going to fill the tissue, make the breast bigger, and if somebody has some underlying issues such as droopiness or misshapen areola, then an implant alone is not apt to correct that.